Welcome back to Studio 10. How many of you shy away from wearing shorts in the summer, not to mention a swimsuit, because you have a problem with varicose veins? Well, you're not alone. It's a problem shared by many, but the good news is there are new treatments available that can make a big difference in your life. I'm joined today by Dr. Daniel Mountcastle from the Mountcastle Vein Center and by Laura Bittmore, who had a vein condition that affected her life on a daily basis. Welcome, both of you.
Thank you.
Okay, well, let's start out. First of all, Laura, we want to get to your story because it's so incredible. But Dr. Mountcastle, tell me a little bit about what you do.
I take care of veins. I'm a really lucky doctor. I use a laser technique invented at Johns Hopkins University that always works. And it doesn't hurt, and it's safe, and it's very, very effective. I take veins that have valves that have failed in them and cause varicose veins and spider veins and restless leg and so forth.
And so the failed veins is the cause then of varicose veins?
Yes.
Okay.
It's a vein disease is one of the simplest diseases in medicine. Imagine the veins that drain the surface of your legs as being an upside-down tree. And there are valves about every 6 inches. And when they fail, everything below is holding the weight of a column of blood all the way up to your heart. And so the branches dilate up and become varicose veins on the surface or inside your leg. And the little tiny twigs become spider veins.
Okay, and a lot of people, that really leads me to my next question, because a lot of people think varicose veins that's really just a cosmetic problem, but it sounds like it really could be detrimental to your health as well.
Well, it is. Your chances of having a deep vein thrombosis, if you have phlebitis in the surface veins, is increased 400%. And the insurances and Medicare pay for treatment of these deep problems. Mm-hmm. The spider veins on the surface are cosmetic, of course, but the deeper problems need to be fixed first.
Okay, so really you could say that then the varicose veins are maybe more a symptom than the actual problem themselves.
Absolutely.
Okay. And as you mentioned, your treatment is new. It's sort of revolutionary, and it's different from the way that varicose veins used to be treated, and it's much safer. And painless, or at least more painless than the old process, correct?
It is. A lot of people have put off getting their veins treated because they think it's going to hurt. They're afraid. They remember their aunt or their mother or sister who had vein stripping and all that terrible pain and 3 weeks of disability. Our patients say uniformly, it's a piece of cake. That didn't hurt at all. Mm-hmm. They walk right after leaving the office. They go back to work. It's that simple.
Well, we want to take a look at some before and afters, because it really is dramatic what you do. And we want to point out, too, that this affects men and women. It's not just, we often associate varicose veins with women. And
half of our patients are men.
Really?
Yeah.
Well, let's take a look at some of those before and afters, show some of your dramatic work here. What are we looking at?
This is a young man, 38 years old. We started an IV near his knee. We put the laser fiber through that. Close the vein over 2 minutes, put a Band-Aid on it, and ask him to come back in 6 months. He lives in California. Uh-huh. And we do a phlebectomy through needle holes. And there wasn't anything to do.
That is absolutely incredible. Let's move on to the next one. Okay.
This is a lady who had to have a phlebectomy. Under 40, your veins are quite elastic, and when the pressure is taken off, they'll shrink back to normal, as his did. This woman had the vein behind this closed. And then we did a simple procedure in the office where we numbed the skin and put a needle hole about every inch and took the vein out, and that's the result.
Okay, and let's take a look at another one.
This is how we mark before a phlebectomy.
Okay.
We again took care of the deeper vein, then a few weeks later marked the vein on the surface, took that out, and the result is perfect.
And look at her leg after that. That's absolutely beautiful. And how about this?
This fellow was a soccer player, and you can see some scars on his legs. He'd had a phlebectomy on the surface before. We went ahead and did the same thing, closed the deeper vein, took out the surface veins, and there he is. And I was hoping Tim would send us some of his bodybuilders, because they also, like this soccer player, traumatize the valves in their veins and end up with these kinds of problems. But they're easy to fix.
Well, how about this one?
Same guy.
Same guy, okay.
Yeah, I'm not sure I got the right legs there, but same kind of result.
Right. Well, we want to take a look at a couple more of these, and while we're
This is a lady 1 week after her treatment. You can see the little tiny red dots where her phlebectomy was done, and some bruising yet. But she's delighted. She's 84, and she said she didn't want to date men her own age. They were too old. She wants to date 60-years, and she wanted her veins fixed right away. I said she should wait maybe 6 months. She said, 6 months for me, Sonny, is like 6 years for you. So we did it.
That leg looked 20 years younger after you did that.
Just a week after treatment.
Wow. All right. Well, as we said before, it's not just this is not just a cosmetic issue. It's sometimes you have issues that can really disrupt your life. And Laura, you were dealing with restless leg syndrome.
Yes. And every night I would just kick, and I would wake up from it. I would just my legs would just kick. And my husband used to wake up also. He said, "What are you kicking me for?" And I said, "Well, I can't help that." So I thought I was going to live with that for the rest of my life. I didn't know that there was something I could do about it until I met Dr. Mountcastle for my varicose veins. But after the first treatment, it just disappeared. It stopped. But as I was treated, I was told by Dr. Mountcastle, they were holding, the two people holding my legs because, they couldn't inject the needles. It was so bad.
Wow. And, a lot of people, I think, probably don't know that restless leg syndrome is a vein issue.
Not always. Sometimes it's primary, and they need these drugs. But a number of cases are secondary to venous insufficiency. And of those patients, at least 85% are cured. Our patients have thrown away their requip. They sleep all night. Their husbands move back into the bedroom.
Has yours?
Yes.
Oh, good.
It's really quite gratifying. I saw a young man at the last national conference do a presentation from Alabama, and he'd studied 2,000 patients who've had both restless leg and had the pain and discomfort of venous insufficiency. And he proved conclusively that at least 85% are cured when you cure the venous problem.
Oh, okay. And
so it's simple to discover. They just get an ultrasound of their leg, and then we see that. And
proceed from there. All right. Well, we want to make sure that our viewers know that we have some special offers for you today. And if you call today, then you are going to receive a free initial visit, which is for what purpose, Dr. Mountcastle?
We educate the patient about venous problems, about the various treatments, and discuss with them their symptoms and their concerns.
Okay. And you can also RSVP for a very special seminar for guests to get to learn a little bit more in a group setting. Tell us a little bit about that.
We're having a luncheon at the Isla del Sol Yacht and Country Club near the Don Cesar in Tierra Verde. It's behind our office. It's free. It's next Thursday, the 20th, from 11:30 to 1 o'clock. I'll speak for 10 minutes and answer questions. And you're welcome to bring a guest.
And that's always so nice to be able to have your questions answered. And again, if you want to call and make your reservation for that, the phone number was on your screen. It's also on our website, studio10.tv. Thank you so much, Dr. Mountcastle, for being with us today.
Thank you.
I know you really, really love your job because you get to help people, and we really appreciate that and can see why.
Thank you.
And Laura, thank you for being here and sharing your story, and I am so glad that you are once again sharing your bedroom.